Okay, so our next presentation will be led by Kendra Montgomery Block. She's an advocate, trainer, and organizer that partners with vulnerable communities of color across the nation for system and policy transformation. For over 18 years, Kendra has worked with community-based organizations. Kendra is the current chair of Sacramento County Mental Health Board and recently received recognition as a Young Emerging Leader from Comstock's magazine. Kendra is a senior program officer with the Sierra Health Foundation and is the lead staff member to the steering committee on the reduction of African American child deaths, Black Child Legacy Campaign, and the Build Black Coalition. Today, Kendra will lead our presentation titled The Fierce Urgency of Now, Building Community-Led Health Equity Movements to Reduce Preventable SIDS Suicide Deaths. This workshop will provide a model of the Black Child Legacy Campaign and its strategic place-based community initiative aimed at reducing the disproportionate African American child youth mortality rate. Please help me welcome Kendra Montgomery Black and panel members Dr. Ethan Cutts, Julie Galeo, and Kelly Todd Griffin.
Again, thank you for the warm welcome and the very powerful introduction. Everyone reads my bio, I'm like, oh, okay. Pretty cool. Again, my name is Kendra Montgomery Block, and I'm so honored to be here with you to be able to speak to you about the Black Child Legacy Campaign and the Steering Committee on the Reduction of African American Child Deaths. I think it's really apropos after Dr. Goldstein and the conversation that you all just had around vulnerable populations and what is needed to make a strategic look at what's going on when it comes to certain ethnicities and cultures and the strategy to really empower them to make different changes when it comes to saving lives of their children. And so this conversation mirrors that conversation very well, and that we're going to talk to you about what does a community do when they know that they have a high number of SIDS deaths, and how do you really break that information out using demographic data, and how do you create a community campaign that really empowers mothers and families to do something different and better for babies. And so our panel today is going to talk again about our work. I have three very wonderful community partners up here that have different roles in our movement, but we'll tell you about a comprehensive approach in Sacramento County that we're leading. So first and foremost, we could not do this work without the admirable support of a number of different funders. First Five Sacramento, the Sierra Health Foundation, my agency, the Sacramento County, we have the Board of State and Community Corrections, and then we also have Health Net. And we're using all of that strategy and funding to really, again, create a foundation and a cornerstone for how we have taken Sacramento County by storm to eliminate and reduce preventable African American child deaths. So thank you. First and foremost, I want to talk about, again, just our focus on community. When we think about who is dying in young, who is dying in preventable ways, and who is dying in frequent numbers, it is African American kids. And a lot of times the headlines that we see both in the news and in the newspapers and the media look something like this. It is either around community gun violence, SUIDS deaths, or child abuse and neglect. And so what we've really done is, again, trying to use and change the narrative on how a community comes together. How did we get started? A kind of a timeline of our efforts. Supervisor Phil Cerna in Sacramento County, every year, child death review reports are delivered to Sacramento County Board of Supervisors. And in 2013, that particular year, Phil Cerna and his new Board of Supervisor in his freshman year started to look at the child death review reports and say, wait a minute, something's actually going on when it comes to the African American population. So he convened what we now call the Blue Ribbon Commission that looked at where were African American children dying, in which neighborhoods in Sacramento County, how were they dying, and why. And so in that, there were a couple of things that came out. One is that we know that's happening predominantly in 7 vulnerable neighborhoods in Sacramento County. They're dying for 4 reasons. So sleep-related deaths, perinatal conditions, so as African American women, we're not getting the right or the culturally competent care while we're pregnant, child abuse and neglect, and again, third-party homicide, which predominantly means gun violence, gang shootings. So those are the 4 reasons. That particular report had also 2 recommendations: that a steering committee on the reduction of African American child deaths would be formed, and that steering committee would be charged with creating a strategic plan and an implementation plan, and assign funding to that plan in order to make sure that our community had the right ground-up approach and top-down approach to be able to, again, reduce preventable deaths. So what does it look like after that Blue Ribbon Commission report? Again, what we knew is that it was happening predominantly in 7 neighborhoods in Sacramento. We knew exactly the 4 reasons why those deaths were happening, and you'll see those up here on the screen. And I'll just take you to the first one, just across the top when it comes to Meadowview and Valley High. So what we know is that on the very, very far right corner there, it would be that third-party homicide. So we know that at Meadowview and Valley High, from 1990 to 2009, there were 19 third-party homicides. We know African-American, 19 third-party African-American homicides. We also know that when it came to sleep-related deaths, 32 of those happened in the Valley High, Meadowview area. When it came to child abuse and neglect, we knew that it was 15, and when it came to perinatal conditions, we knew it was 116. Out of those, the total number in the 20-year period in that Blue Ribbon Commission report is 182 deaths. I'm going to say that again because we can look at these numbers and kind of gloss over it, but every one of those numbers represents a death of a child. And so we as a community had to do something. More importantly, we started to look at the percentage of the ethnicities in the community, right? So in Valley High and Meadowview, we know that out of all of the deaths, out of the 446 deaths in that 20-year period, 182 of those were African American, and we only represent 16% of that population. So what is going on in that neighborhood? We had to take a deeper, closer look. And so I do work at a health foundation, and we use the social determinants of health as a way to approach this work and to build community capacity. And we use this particular slide to talk about equality, equity, and then our reality. And from this slide, you understand that when we think about equality, equity, and our reality, we had to do something different. So equality means that everyone gets the same thing, right? Everyone gets the same thing. Whether or not that works for you, you're still gonna get it, right? Equity means that we're getting the community what they need in order to improve. So on that second slide, you see that everyone can see the field, and everyone's getting an opportunity to watch the same thing, right? But our reality in this slide really mirrors almost digging ourselves a trench when it comes to this work. So we had to do something different. So what did we do? Again, we focused on those 7 neighborhoods. We focused on those 4 issue areas: perinatal conditions, infant sleep-related deaths, child abuse and neglect, and third-party homicides. We knew that it was happening in Arden Arcade, Del Paso Heights in North Sacramento, Foothill Farms in North Highlands, Fruit Ridge Stockton Boulevard, Meadowview, Oak Park, and Valley High. So the steering committee, and Dr. Cutts is going to talk to you about his role on the steering committee on the reduction of African American child deaths. That took up about a 6-month process to really look at the best practices, not just across the nation, but across the globe around issues around reducing African American child deaths. That we knew that we had to have a ground game and a ground campaign to really bring our community to both knowledge, change in their behavior, and we knew that it had to start with promoting advocacy and policy change. We knew we wanted to make sure that there was a connection to what the county was doing, what the social service agencies were doing, their leadership, and so we wanted to have and continue to have a strong strategy around equitable investment in systemic impact. The third part of our kind of strategic plan as a committee was we really started to look at a coordinated system of support. So we were able to re-grant almost $7.5 million of the dollars that we were able to bring together from the county and First Five and all the other funders that I told you, and actually re-grant those out into the 7 neighborhoods, into community incubator leagues. We call them anchor institutions. So in Valley High School, or in Valley High, we have Pastor Les Simmons in the South Sac Christian Center leading this effort. In North Sacramento, Del Paso Heights, we have the Roberts Family Development Center leading this effort. In Oak Park, we have the Greater Sacramento Urban League leading this effort as an anchor institution. So again, 7 communities, 7 anchor institutions. But not only that, County Social Services also came alongside of us to co-locate services inside of those anchor institutions. So you can walk into the Oak Park Urban League and having any one of a myriad of issues, and there will be a probation officer there, a child welfare officer, or a DHA or eligibility worker, as well as even SATA, Sacramento Area Training and Employment Agency, so that no matter what happens, no matter what issue that family walks in, they can get wraparound services and the social services that they need so that they don't become one of those statistics on our sheets. So coordinated system support is a big part of what we have been able to implement over the past 2 years. Next, we are about data-driven and collective impact, right? We're documenting what we're doing all along the way. That is why you see this great videographer in the back. No one is getting documented except for our panel. I just want to make sure you're okay with that. But it's very important for us to document along the way every step that we do. 1, so we can have the flexibility and course correction, but 2, so that we understand what works. And so we have a very strong data collection and evaluation process. I invite you to go onto the blackchildlegacy.org project so you can see those theory of change and logic models and the data collection that we've been doing around quality programming and efforts to really build people's capacity to understand what these issues really are. And then lastly, we have a really vibrant public campaign, our communications and media awareness. At first, we started as the steering committee on the reduction of African American child death, and that is the truth. But that is a big mouthful to keep saying to everybody. And so we wanted to breathe life into the community. And so the very public face of this campaign is called the Black Child Legacy Campaign, because we really are trying to make sure that there is a legacy in our community, and it is not about death, preventable deaths, it is about life and dignity. And so we're extremely excited to continue this work. We have a strong infrastructure. Again, I told you there's a steering committee. We have folks that are residents, community leadership roundtable folks that are just on the ground, that are working in those institutions and in those neighborhoods to change the perception as well as the resources that families need in order to be able to sleep their babies safely. Again, 7 focused neighborhoods. We go east to west and north to south in Sacramento, but I'll have you know that these are the vulnerable neighborhoods and predominantly people of color. Let's go to our panel. Today I have a great panel that we've been arranged just so that you get a very depth of what are we doing around infant sleep-related deaths and how we've strategized as a community. So I have Dr. Ethan Cutts, who not only is the best pediatrician to the best 3-year-old that I know, but he's been practicing for 20 years, and has been doing sleep-related work for 10. And it definitely is our resident expert here locally, and is also on the steering committee on the reduction of African American child deaths. And then we have Ms. Julie Galero, who is the executive director of First 5 Sacramento. And I will say, you know, First 5 Sacramento really did take up the charge first and the most, right? They put into motion not only funding, but was able to actually put aside dollars to form the steering committee so we could have a plan, an implementation plan, and I could stand before you today and talk about the wonderful work our community has done, and that's because of First 5's work. And then, most notably, we have Ms. Kelly Todd Griffin, who is the, I'm gonna get her title right, Director of Strategic Giving and Community Engagement at Health Net, California Health and Wellness. And she really has come alongside all of our work to go deeper in some of the communities that we know needed additional effort. What we heard from Dr. Goldstein is that it is going to take a cultural revolution in order for people to really understand the history of sleep-related deaths in the African-American community, and how do we train folks that look and feel like us so that they too can have the efficacy to save their children's lives. And so Kelly really came alongside and helped us go deep in the Valley High neighborhood with the cultural broker effort that she'll talk about in 95823. So I'll open it up with Dr. Cutts. We'll go to your slides first. Our goal is to go through each of the panel members and then even open up for a few questions afterwards. So I'm looking for Kay. So if we're not on time, you're gonna let us know.
Yeah, I'm gonna come walk near you.
Okay, that's good. So again, I'll open it up to Dr. Cutts and, where you go?
You want to try this? Okay. Can everybody hear me okay? Should I try to move this a little closer? Everyone can hear? So, thank you for having me here. I'm very, very excited to sort of present our data. After seeing Dr. Goldstein speak, I was telling Julie here that I'm just chomping at the bit to tell you some of our data here. A lot of the same problems that he talks about is a problem everywhere. It's a problem here in Sacramento. So we started what we call the Infant Safe Sleep Project. We started sleep-related deaths just for the very reason that we can't go between SIDS, SUIDS, undetermined. So we have something called a CDRT, which is a Child Death Review Team. We look at every single child who dies in Sacramento County, and we look into all the various causes of that. And from there, we sauced out the children who died in their sleep. We went with SIDS, we went undetermined, we went with SUIDS. Anything that was a sleep-related death, we would put into this. And this is our data here. So you can see these are the numbers of children who are dying in Sacramento. We actually have 20 plus years of data. This is what we've been doing on this here. And you can see what's interesting about this slide is that you can see that the top graph is the total number. So we're not dealing with many children, many infants. 25 at the most per year. 10,000 children are born in Sacramento every year. So that's to give you an idea of the numbers, which is why when we try to sauce out the risk factors and the numbers are so small, it's very hard to really get statistical sort of backing of what we're thinking. So we just looked at the grand numbers. The other striking thing about this slide is the second number, the bottom line, that's African American childhood deaths. And they are about 10-11% of the population in Sacramento, but they represent about 40 to 50% of the sleep-related deaths too. So, our next slide, I talk about risk factors. And again, I agree, these are not causative, these are risk factors. But what's very interesting about our data, what we looked at, every single child who died in their sleep had at least one of these risk factors. Let's put it another way, if you don't have these risk factors, you don't die. And that's our data here in Sacramento. I don't know how it translates to other communities throughout the world, but that's what we have noticed here. We have 30 years of data to show this, that these are the risk factors, which is really a non-infant bed, sofa, no crib in the house. In other words, do they even have a safe place for this child to sleep? Co-sleeping, that's the really controversial one that people talk about, but we do know 50% of the time that children were found co-sleeping with somebody, a sibling, a parent, a relative, who knows? So we do know that this is a risk factor. Again, it doesn't cause it, but it's a risk factor. And then the back to sleep campaign too is part here, basically not sleeping on your back. So that's our risk factors. And again, we took this message and we went into what we call an empowering message. How can we tell parents to really keep their children from dying in their sleep? So we came up with what we call the ABCs of safe sleep, which is alone, and your back, and a crib. And then we added a few other things onto that too. Put nothing to sleep in the area, don't ever dress the baby, and don't smoke anything around the baby. This is based on, the AP has similar guidelines too that came out right when we did this as well. And you probably are familiar with some of these things, but again, we wanted to really distill it down to a simple message for our parents to empower them. And this is what I tell my parents, is I can guarantee your child will not die in their sleep if you do these things. And that creates a power that they feel like, okay, I can do something to keep my child, because that's every parent's nightmare, is to wake up next to their child who's died. Okay, so we tried to go out to community partners. We've been working on this for a while. We found out we weren't getting a lot of traction, so we decided to actually take it into the hospital systems. And so I work for Kaiser Permanente. Kaiser Permanente has 2 hospitals in the Sacramento area. We have one in Roseville, we have in South Sacramento. We I actually went to my nurses and I said, help me build a program. I don't know your day-to-day activities. I want to make sure it's something that you can roll into your normal routine of discharging a baby, and so that it has some traction there. The nurses took it and ran with it, okay? I just gave them the data, they just said, let's just do it this way. And we looked at a lot of different things. We trained every single nurse who now works on our maternal child unit. We have it in HealthStream. We have frequently asked questions for breastfeeding, other things like that. What do I do with my baby? We ask every patient, every parent basically, what we call an open-ended question. We don't say, do you know where to sleep your baby? We say, how do you plan to sleep your child? And from that, we got into, well, this is, what do you mean by that? So we can give more information. This campaign is really education. We found out that, parents don't know this data, and we needed to give it out to them. Once we figure out where, if they don't have a safe place to sleep a child, we actually supply cribs to them, okay? This is something that First Five gave us a grant for this. Every single parent who says, I don't have a safe place to sleep their child, we supply a crib for them free. It's $50 a crib, it's not that expensive. You want to talk about a way of changing health initiatives, $50 a child is nothing. I'll tell you that we have in Kaiser, as of March of this year, we gave out total cribs. Our total cost of cribs giving out in the 2-3 years that we've been doing this has been about $10,000. Okay, that's how much is it cost? Yeah. How much does it cost to feed a group of nurses for lunch? More than that. So we've now rolled that into our program here at Kaiser. We give cribs. The important thing to know is that it's not a crib program, it's an education program that provides cribs if you need one. We have had families in Sacramento who've had a crib in their home who the child has died because they didn't get the message. So we actually do a follow-up phone call 2 to 3 weeks down the road. How's it going? How's it going with your crib? Are you still using it? Oh, well, I'm not so sure. We reinforce that message too. So how is this done? Okay, so let me just change that. Kaiser, it did so well at Kaiser that UC Davis, Sutter, and Mercy are now all doing the same thing. So every hospital system in Sacramento is doing a similar program all throughout this. So how has that worked with us? Again, numbers are small, don't get cut, but so far numbers are great. So you can see the top number, we went from 25 in 2012 down to 14 a year after that. But look at the bottom number, that's African Americans. Okay, they went from being about 50% down to 3. Okay, 3 children, and I can't even see what year that is. My God, the last year. So we are hoping it's not just a blip. These numbers are small. A lot of this has to do with the CILs, our community incubator leads. They're tied into this. They all know this information. They've been giving it out. Our focus groups have all said we need to know this information not just once, not just twice, not just 3 times. Every single time we touch somebody who knows something, we want to hear this message. And we've been saying this message, and we've been targeting those groups, and it seems to have been working. Okay, so I think I'm going to move on to Kelly because I'm sure I overspoke. But I'll be available for questions.
Don't I have a cool job? Thank you guys for being here. Let me just give you, first of all, I shouldn't have known she was videotaping, so I should have put my red lipstick on. Anyway, so let me give you guys just a little bit about Health Net. So Health Net, many of you guys know, is a health plan here in California, but we're the largest commercial Medi-Cal plan in the state with over 2 million members. And we're in 31 counties, Sacramento being one of those counties. And so we really focus on the most vulnerable populations throughout the state. And we try to kind of lean in where we can. We're not one of the biggest funders in the state, but we try and be as impactful and meaningful as we possibly can. So just to give you some of our kind of foundational qualities, but one of the things that we really like to point out is our purpose, which is transforming the health of the community one person at a time. And this culture broker program is really focused on that. So we connected with Sierra Health Foundation and looked for opportunities for us to lean in. And so we determined that this was the most appropriate area for us to lean in, because when we look at particularly Sacramento, we do use data to do everything that we do. And we realized that in 95823, which is the Valley High Meadowview area of Sacramento, we had a really large member population, and many of the folks that we have in that community are moms. And we recognize that we have, although we have a lot of different demographics, our African American moms seem to be the ones that didn't get the services that they needed when they needed it the most. And one of the areas of concern that rose up was really around maternal and infant mortality rates. And so we started talking to Sierra Health Foundation about the Black Child Legacy Campaign and what it is that we could do. And we really thought about it from a workforce development component. Because what we recognize, particularly in the African American community, is that we believe in what we like to call the community mavens. So we know that there are folks in the churches, we know that there are folks in our community that kind of give us that kind of information about how to take care of our babies, but also how to take care of ourselves when we are pregnant. And like one of the ladies said, that doesn't necessarily mean they're given all the right information, but it helped them along the journey. But we also know social determinants of health, that those things have changed over the years. So we wanted to do something where we could get an understanding of the experience. And so the first thing that we did on the Cultural Broker Program is do what we call journey mapping. And the journey mapping is, what is the experience that Black moms go through when they are pregnant and then after they have their baby. And so we pulled together a group of community mavens and mothers who have had babies within the first 6 months since they've had babies to come together and have kind of a community conversation. And that community conversation was really about what happened, what's going on, what are the barriers that you see. And the thing that was really eye-opening for us is that there's no common language. There's absolutely no, even with cultural brokers, we had cultural brokers that work for FQHCs, we had cultural brokers that work for nonprofits, and they were giving information about this, and this other one was giving information about that, and we realized that that whole message was really diluted. So we started working with Sierra Health Foundation to really come up with what we were calling the cultural broker curriculum, so that we can get all of the brokers in the county of Sacramento all on the same accord to help us navigate a little bit better around the system, because it is a complicated system. We actually work throughout California in one of the areas, particularly like a Los Angeles, that has like a county hospital. That's not something Sacramento has. We have an FQHC system that's different in other types of the state. So we realize that many of our members are depending on the Kaisers, the Mercies, the Dignities, or Best Mercies, but the Sutters to receive their care, and they're receiving their care in emergency instead of going to their PCPs. So we wanted to know, how do we get the information to the members the way that they want to receive the information from the people that they trust the most? And I remember one of the conversations with one of the ladies with one of the culture brokers from an FQHC, and she says, well, I don't get paid for this. I just want to make sure that we don't have any more babies that die in our community. And so we recognize that there are people there that needed just understanding of the system, because part of the barrier is not understanding the system, not knowing that they get Medi-Cal as soon as they're pregnant. We realize that talking to people that they didn't know they have insurance. And if they don't know they have insurance, then they will delay their care. And so we wanted to make sure that we removed all those things. And then after we did that, and Kendra and Madeline worked really hard on a white paper so that we could look at kind of what are the lessons learned, we recognized that there was an additional barrier, and that additional barrier was we didn't have people that were actually embedded in the healthcare center, that system that actually looked like the patients that we were trying to serve. So our new focus coming into this year was taking that cultural broker program and creating a community health bridge program with the Greater Sacramento Urban League, with Sac City College, and with WellSpace, which is one of our FQHCs in the community. And what we decided to do was take a curriculum, which is a community health workers program that was created actually by Sierra Health Foundation at Sac City College and create this bridge. And the bridge is that we put it in the community where they live. Del Paso Heights is another one of our priority areas for Sacramento. We put it in there, and then we recruit people that actually are from that community or serve that community. The community incubator leads that Kendra is talking about, getting them into the program, and we ensure that they pay nothing to go through this 1-year certification program. And then when they come out, they can work for companies like Health Net, Kaiser, First Five, as these navigators, these community trained navigators that don't just know the community, but they understand the experience of the community. And we hope that with that journey, we're going to be pushing out more people to navigate the care even more effectively, particularly for women who are expecting or plan to expect in the next couple of years. So.
Thank you. Next is Julie Galelo, First Five, Sacramento.
You do have a pretty great job, Kelly, but I love mine too. Except for the public speaking part of the job, so I'll have to go throw up when I'm done here. But anyway, as probably most of you know, First Five is a agency where our mandate is to improve the health and well-being of children aged 0 to 5 and their families, and we're funded by tobacco tax. Our commission completes a strategic plan, and that plan becomes our roadmap for how we're going to invest in our community. And we, in addition to direct services, we also invest in things like policy work, advocacy, and systems change. And for us, the Black Child Legacy campaign really checks both of our boxes for direct services, as well as for the work that we're doing in systems change. And you've heard that African American children in our county die at twice the rate of any other race in the county. And you know that the top 4 causes of death, 3 of those top 4 causes of death primarily happen in the first 5 years of life. And that's sleep-related deaths, perinatal conditions, and child abuse and neglect. So, and many of those are preventable with some early intervention. So this was like a great way for First Five to spend our money and our political will. So we are an early partner in the work, and our role, yes, there you go. Our role really is threefold. We're a funder, an educator, and a convener. So from 2014 through our current strategic plan, which will end in 2021, we will have invested $14 million in this effort. Really through our direct service programs like Safe Sleep Baby, which is our education campaign that Dr. Kutz was talking about. That's the program I'll focus mainly on today, but we also have 2 other programs that we fund direct service for. One is very similar to a cultural broker program. In fact, we used to call it a cultural broker program. We just, because of confusion, we changed ours. We now call it a pregnancy mentoring program, but very similar. Women from the community are mentoring other women who are pregnant in the community to have the best possible birth outcome for their child. And we do lots of parent education and home visiting and crisis intervention through 9 family resource centers that we fund throughout the county in these hotspot areas. And 2 of those 9 we created specifically as part of our this campaign. So we are in each of those communities, working very closely with those anchor agencies that Kendra mentioned, the community incubator leads. In fact, our pregnancy support staff are actually housed at those, co-located with, at the community incubator leads. So the other thing, as far as educator goes, we engage in public awareness campaign. Ours is called Sac Healthy Baby. And the stress, as Dr. Goldstein mentioned earlier, We did a lot of focus groups. We did massive formative research before launching the stress campaign. And one of the things that we definitely heard about was just that being pregnant and being Black is stressful, and that institutional racism in the county. And so acknowledging that was the first step, and working to provide education. You can go on to our sachealthybaby.com and punch in where you live, and all of these resources come popping up. Connection to all of our funded services, to the community incubator leads, to your doctor, everything. So it's a great resource. So we do lots of public education, and we also talk with decision makers. We testify at the Capitol. We give presentations to our Board of Supervisors, who have been very supportive of Black Child Legacy Campaign. And we also talk with other funders around the state, including our other First Five colleagues. I've got Rollins out here from Kern County. So we share what we've learned by doing this work with all of our other First Fives. Finally, we're a convener. So we pull together, we have what we call our Reducing African American Child Death Collaborative. And that is folks from our FQHCs, our county health departments, like our Black Infant Health Program, Maternal Child Adolescent Health Program, our Family Resource Centers. Our partner, one of our biggest partners is the Child Abuse Prevention Council. We call them CAPSI here, and CAPSI works with us specifically on our Safe Sleep Baby campaign. So, I'll share some of the accomplishments of our Safe Sleep Baby campaign, and if I have time, I'll throw in a couple from our other programs too. In a significant number of the sleep-related deaths in our community, there were risk factors and unsafe infant sleep conditions present, primarily non-infant bed, co-sleeping, and sleep position. And while our Safe Sleep Baby campaign, it reaches all families with young children, we are really focused on these communities that were identified and have a targeted approach to reach African American families. The campaign includes direct education and, as Dr. Cutts mentioned, the provision of cribs for families who need them, all with the goal to reinforce safe sleep practices. Our First Five partners with Child Abuse Prevention Council to implement this specific program, and CAPSI produced a very community-driven video. I didn't have time to show it here today. It's about 18 minutes, extremely powerful, of people from the community who have experienced a sleep-related loss, and it's just very moving. It's on our website, firstfivesacramento.net, if you would like to see it. So through this video, through intensive research and talking with families, this is where we learned that they want to hear this message everywhere they go. All providers saying the same message: alone, back, crib, always. So they trained 1,700 women. I just picked a slice in time for you. This is 2016-17 data. But those 1,700 pregnant women and new mothers were trained on safe sleep. 1,300 of them through a one-on-one home visit. So they are out in the community, out where moms are, pregnant women and mothers, not expecting them to come to us, but going out to them. And then there were 358 women trained in workshops. Of those 1,300 home visits, the majority of these are proportionately toward African American families. But again, we don't say you're not African American, we're not going to train you on how to safely sleep your baby. So it's all inclusive. We also, through CAPSI, they train our providers, so they're going out to our family resource centers, nonprofits, FQHCs, and everybody in the community, and teaching them a 2-hour training on safe sleep so that they can then forward that message to all of the clients that they see. And then they handle our crib distribution, tracking. They're the ones who are calling afterward to find out if mom is using the crib, and doing that follow-up education. So our pre and post tests show that for the most part, parents are getting it. They're hearing the message, they're following the safe sleep tips, and so we're pretty excited about that. And as Dr. Cutts mentioned, African American sleep-related deaths have declined each year since the inception of our Safe Sleep program. The rate dropped from 3.1 deaths in 2013 to just 1.6 deaths per thousand in 2015. The other work that really Dr. Cutts' presentation was around primarily is our campaign associated with the hospitals. So we're in all 8 hospitals. CAPC's staff is there training and improving the practices within the hospitals. This is our big systems change effort. So like similar to car seat safety, instead of asking just how is your baby going to get home? Do you have a car seat? Nurses are now asking, how are you planning to sleep your baby? And if they need a crib, they're getting one. And you can see from our slide that they're reaching a good percentage of population.
So, again, I want to thank my panel for joining me up here to tell a really robust story around how Sacramento County is using a targeted but universal approach to save the lives of babies. And I did have this last, as we're closing out, picture that we are just a small group of a lot of community members that have a lot of training and expertise. Dr. Cutts is definitely a pediatrician that sits on the steering committee, but we have the public health, chief public health officer, the assistant probation officer, we have the deputy director of the Department of Health and Human Services, faith-based leaders, community leaders. This picture really represents the large amount of expertise that's in the room when it comes to the community of Sacramento that's been come together to address this particular targeted but universal approach. Thank you.
Thank you very much.